Hi, Katie.
Hi, how's it going?
Good. How are you?
I'm doing awesome. Thanks for
Well,
having me.
oh, I'm so happy you're here. This is a very hot topic we're going to talk about today. I see your glorious book behind you, your work of
Yes.
love. So why don't
Yes.
we start there and then go backwards?
Sure. So I wrote a book called Saved by the Mouth,
Great
which is
title.
my target audience was people my age, which is, I'm 40. So
Yeah,
mid to
we're the Saved by the Bell
I
generation. Yes, a
exactly. And
thousand
so I
percent yes.
wanted, yeah, so I wanted to appeal, that was my target audience. So I knew they would get the
Yes.
title. And so that's why I wrote it. It really is just a passion project of me trying to get information out there all about the oral systemic link because I found every single day I was saying the same thing over and over and over to patients and clinicians about how the mouth affects the entire body. And so, oral health is not really everyone's favorite topic. And so when I wrote the book, I tried to make it super cheeky and lighthearted and an interesting read. Um, it's very laid back, very approachable. And every chapter in there touches on a different organ system that the mouth affects. And I talk about a real example of a patient that I had in my practice, how we were able to help manage or eliminate their condition by improving their oral health. So, really
I will
proud of it.
admit that there was a dark period of my life where I did not go to the dentist for like 4 or 5 years. And when I finally went back, I my cholesterol was through the roof.
Mm,
And I needed wisdom teeth out, and I had like four cavities. And
yeah.
yes, it was all related for sure.
Wow.
I
Yeah.
know. Isn't
I
that
hear these
crazy?
stories all the time.
I know.
We're no one's favorite people. We're always compared to like the gynecologist and the driver's license agency. So like
Oh.
I totally get it. Why people don't come and see us.
Well, let's talk about because you have a very targeted reason why you ended up in this field. So let's talk about because I have a lot of reproductive doctors on. I don't usually have oral health people on. And there's like a very clear reason why they went into reproductive science. And I
Mhm.
think for you, it's the same, but for oral dentistry. So can you tell me a little bit about your backstory?
Sure. So when I was 14, I was involved in a ATV, a four-wheeler accident. I was on a four-wheeler, the one and only time I didn't have a helmet on. And sure enough, somehow I crashed face first into a telephone pole going 35 miles an hour. Um, Lost a bunch of teeth, as you can imagine, broke everything from my eyebrows down, ended up in a coma for a few days.
Can
Had
I
my
ask who was driving?
I was.
Oh, you were driving your
So
own. Wait,
embarrassing.
where were
Yeah.
you? What state was this
So
in?
I lived in a small town in Illinois and I lived
Okay.
out in the country in a subdivision.
Okay.
And we had just gotten home from like boating. It was July 5th, 1998. And my friend was like, let's go on a ride on the four wheeler. And so I was like, okay, well, let's just go around the block real quick before your mom comes and picks you up. And so it literally meant to be like this very casual ride. And somehow I think because I don't even remember that day, but from what I was told or what she could remember, she was trying to tell me something. And when I turned back to hear her better, I guess I turned the wheel and jumped a ditch and
Ugh.
ended up face planted. So I was in a coma for a few days, had my jaws wired shut for 8 weeks.
Mm.
Um, and, they wired my jaws shut with all of these broken teeth and missing teeth. And for the next 8 weeks, I was surviving on ice cream, with Hershey's syrup and strawberry syrup, box mashed potatoes, jello, pudding, like horrible stuff. I think back and I'm like, where were my parents in this? They should have had me
They were
doing
probably such a hot mess of like, is she gonna live?
they
Is she? Yeah.
yes, they're like, just give her anything that makes her happy at this point
Yeah.
because we're just trying to keep her alive. And so a couple of things happened. One is obviously I started developing a lot of dental infection and inflammation that made me very uncomfortable and started affecting the rest of my body. And then I became emaciated because I was malnourished. I couldn't eat. And
Mm.
so my liver enzymes spiked, my kidneys started shutting down, and I learned from a very early age just how much your mouth can affect not only your physical health, but your mental and emotional health. And
Of
so it
course.
was 4 years of 9 reconstructive surgeries to be able to fix my face. Cause when they took the wires off, they were like, okay, open your mouth. And I was locked. I couldn't open it all. So
Mm.
I was stuck with a locked jaw up until my senior year. And then they finally did a rib graft surgery. So they took out my right TMJ, replaced it with my rib bone. And And it wasn't until senior year, so 4 years later, that I could finally open my mouth enough to get dental work done, and to replace missing teeth. And so I just remember once my dentist was able to screw in my dental implant crown and I had a permanent smile. I mean, it was life-changing for me because I had been, so embarrassed and humiliated for 4 years. I mean, can you imagine as a high
And
schooler
like the
going,
worst 4 years to be
the
embarrassed. Like,
worst for
yeah.
those are your formative years, and
Yeah.
I just wanted to be like the popular cheerleader. And yeah, it was tough. So
Talk
that's
to me
how I
about
got into
that.
dentistry.
Yeah. And talk to me about, because I know you've talked about sort of being bullied during that phase. So can you tell me more about that?
Yeah. High school kids are mean, right? And so my
Yeah.
nickname was fuckface. That's
Mm.
what people called me because I would have surgeries about every 6 months.
Mm.
Because they would do a surgery and then I'd have to heal, and then they go back in and do another surgery to undo or repair, some old stuff. And so, like, I never had a chance to really fully heal. And so every 6 months, I would go in for a new surgery. And so what would happen was, and this is pretty graphic, but I have a scar all along the side of my face, like a facelift scar. So they cut me there and then they pull the face over. Well, there's a facial nerve right there, and your facial nerve controls your smile and blinking your eye and all the things that we take for granted. So for 4 years, this whole side of my face was completely paralyzed. So I had to like tape my eyes shut at night. I couldn't smile symmetrically, which I still can't really smile symmetrically, but I still can't feel like this side of my face. So I laugh about it now, but when I go out to dinner, I always have food on my face because I
Yeah.
can't feel it. Yeah. Um, and then on top of that, I had massive swelling. And as they're trying to do the rib grafts, and I had my jaws rebroken, reset a couple times. I mean, I looked like, the Elephant Man. I don't know if you remember that movie from when
Mm-hmm.
we were really little.
Mm-hmm.
Um, and so, yeah, I got bullied a lot and made fun of a lot because of that.
Ugh, it breaks my heart. Like I literally, bullying is, I just, the minute I tap into thinking about a kid going through bullying, I could just cry. It's so not fair.
Totally. And now we know, we're aware of it. We try and educate people not to be bullies or what to do if they do get bullied. But back when we were in school in the 90s, like it was just part of,
Yeah.
everyday life. So yeah, it was pretty terrible during high
I'm
school.
so sorry.
That's
But
okay.
I'm really glad that you made it through.
Yeah, I made it through and I got a profession out of it. And I think it allows me to have a massive degree of empathy for my patients who are going through something. So
For
all in
sure.
all,
Okay. So
it's
you
fine.
decide, so you went to undergrad, but you knew at that point you were going to go to dental school.
Totally. Because
Uh-huh.
during this process, I had a lot of doctors, and the doctors were terrible. The medical doctors were terrible. I mean, they just didn't understand what I was going through as a 14-year-old freshman in high school and how
Yeah.
horrible it was for me. And they had no empathy and they were rude and they were very impatient with me. But it was my dentist and my oral surgeon that were like saints. And to this day, I'm still in contact with them. And they really helped hold my hand and listen to me and tried to, treat me with gentle gloves. And so I was like, I want to be that type of person for people, for patients. Because before that, I wanted to be a doctor.
Mm,
And then this whole experience switched me into dentistry.
I love that. So coming out of dental school, did you go right into like someone else's private practice? What was your career trajectory?
So, right after dental school, I got straight to work. I thought about specializing, but I had paid for my undergrad in dental school myself. And so I was like, oh my gosh, I just have to start working. So I joined a large DSO at the time, which is like a dental chain. And I joined them in 2010 and started working in Colorado.
Okay. And you're still in Colorado now, right?
I am, yeah.
Okay.
Yeah.
Nice. And what are do you have physical leftovers from the accident still?
Oh, totally. I still can't open very wide. I can't hold my mouth open for long. So being in the dental chair is like excruciating. But because of everything that had happened at such a young age, I'm constantly in need of getting more dental work done. So I can really empathize with those patients that, always have something wrong when they go to the dentist. Um, yeah, so a lot of jaw pain. Can't open wide, can't stay open wide.
Do you sleep with a
Can't
jaw guard or a mouth guard?
I do, yes. Mouth guard, and mouth tape too, which I talk about in the book. And yeah, I still can't feel, that side of my face. And I have a pretty asymmetric, smiler when I talk. I treat that with Botox. That helps it quite a bit become more symmetrical. But yeah.
It's funny timing because we've been trying to get this on the books for a while. My husband actually just had surgery on his jaw.
Mm,
He had to have his parotid gland removed.
wow.
Sorry, babe, I'm putting this on the air for you.
Yeah.
Um, but it's shocking. He also had like the facelift scar, and I mean, so
Okay.
he's only a month out, so
Yeah.
he's still drooling a little bit and figuring it out. Um,
So you know exactly what I'm talking about.
yes, literally know
Yeah,
exactly what you're talking about. And shocking how impactful that one little area on his jaw is. It's like his ear, his eye, his chin, his neck, it's his
totally.
shoulder. And it's true. It's like one of those things you don't think about that really has an impact on every part of our body.
Mm-hmm, mm-hmm. And it's
Crazy.
this is like what you interact with people
Right.
with, right? And so when something is wrong with your oral health or with, any part of your mouth, not only does it affect you physically, but like mentally and emotionally when this is how we interact with each other. So it can
Yeah.
be hard.
So when you left high school and got into college, you kind of had a clean slate because your surgeries were done for the most part.
Yeah. I mean, I people can always tell, that I've had something done or something was done. So, yeah, I had a clean slate from the bullies. So that
Yeah.
was done for sure. Yeah.
Yeah. Can you talk about why my cholesterol would go up because I didn't go to the dentist?
Yeah. So the big thing with oral health and systemic health is we know that the bacteria in the mouth doesn't stay in the mouth. It goes in through our gum tissue and translocates to other part of the body. And when it starts to do that, it starts to cause a lot of inflammation in other areas. And the bacteria can directly affect other things. And one of the main things that it starts to affect is the heart. And we know that it causes vascular inflammation. It can accelerate atherosclerosis, which is plaque formation. And it does that by increasing, I don't want to get too scientific here, but the inside of our blood vessels is lined with something called the endothelium. And the inflammation that the oral bacteria causes that endothelium to start dysfunctioning, meaning it can make it more permeable so things can pass through easier. It makes it stickier, so plaque and other things can start to stick more. And part of plaque formation is cholesterol. And so oftentimes we'll see patients that have oral issues also present with high cholesterol, high blood pressure, and
Mm,
arrhythmias and other things like that.
so important. My gosh.
Yeah. When we have, just to go a little nerdy further, when
Yeah,
we
I
have
love
the
nerds.
bacteria that gets into the bloodstream, our body, our innate immune system secretes first line immune cells called macrophages. Those macrophages go out and they just try and eat up. What's that? Like Pac-Man? I'm trying
Yeah.
to think of. Yeah.
Yes.
Kind of like Pac-Man will go and try and eat any invader that's not supposed to be there. Well, one of the things that it'll eat up is cholesterol that's already free floating in your body. So what happens is it's going to eat up this cholesterol that was already there. And once it eats up that cholesterol, it's going to turn into something called a foam cell. And those foam cells then will stick to the inflamed, increased stickiness endothelium caused by the inflammation of the oral bacteria.
God.
That
Okay.
was I
I
wish I
like
had
it
like
though.
a flow chart to,
Totally. You need like
yeah.
a pointing stick. So true or false, you're not supposed to wake up and drink water right away until after you brush your teeth because then the plaque will from your mouth overnight will go down.
I've actually never heard that.
Oh my God.
Yeah.
This is
People are
okay.
saying that.
I have heard that before, and
Okay.
I'm like really, you know how we all have our weird things? Like I
Yeah.
have got to brush my teeth the second I wake up.
Okay.
And then I have got to drink some water, but I will not drink the water until I've brushed my teeth because I have this notion that the plaque from my mouth that's been building up all night will then go down and right into my heart.
Well, here's some good information for you. We do swallow 80 trillion bacteria a day from our mouth.
Great.
But most of the bacteria that we swallow are going to be eradicated in our stomach and in our small intestine because of all the digestive enzymes and the acids that's there. The bacteria that we have to be concerned about affecting our hearts and fertility and colon and brain and all that are the gram-negative anaerobes, which are the bacteria that live under our gum tissue. And so
Mm,
the only way really for them to get in our body in a significant amount is to translocate through our gums. And so it does that if those bacteria have been present a long time, and there's inflammation present.
Mm.
So drinking water and swallowing the bacteria is not really, in my opinion. I'm
Harmful.
sure some other dentist is going to come back and be like, no, you're totally wrong. But if we're worried about bacteria going to our heart, it's going to get to our heart through our bloodstream.
Mm.
And the only way for bacteria to get into the bloodstream is through the gum tissue,
Okay.
not by swallowing.
So
So
that makes me feel better because also like my kids don't brush their teeth first thing in the morning and I'm like, oh, they're getting all that plaque, but it's not so bad. Okay. That
no,
makes
it's
me
not
feel
so
a little
bad.
bit better.
Yeah, yeah, you're okay. It's
So
actually really good. Like, and I always tell people during the night, like if you wake up, drink as much water as possible because at night is when our mouths dry out and our saliva production decreases. And when we have less moisture and saliva in our mouth, we increase plaque biofilm production because saliva and water help hydrate and protect the teeth and keeps them moist so that bacteria can't stick. So when you get
mm,
really dehydrated at night, which we all do, our teeth get real sticky and gums get real sticky. And that's when we develop more plaque. So water is actually
interesting.
good.
Okay. Well, to that end, let's talk about the mouth tape because I
Yeah.
know it's in your book. I know it's been very also trending and I'm terrified of it because I'm afraid I'm going to stop breathing. But
Yeah.
what are the benefits and why do you do it?
So we get really concerned about sleep apnea. So I want to kind of back up a little bit. We get really worried about sleep apnea. Sleep apnea is fatal. It's just a matter of time. And about 70, I've seen statistics, 70 to 75% of people who have sleep apnea are undiagnosed, which is very alarming. You know, that's why people die in their sleep. When they go to
Yeah.
sleep and they don't wake up, they have heart attacks and strokes. And most often it's because of sleep apnea.
Mm.
So people need to get tested to make sure they don't have sleep apnea. That's number one. Um, but number two, we know, not only is sleep apnea really dangerous for our heart, it's also really dangerous for our brain. We know that it kills brain cells, can lead to cognitive issues and increased risk for stroke. It's directly related to diabetes as well. But most of the time when we have sleep apnea, we're breathing through our mouth. And the reason why that is bad for dentists or for oral microbiome is when you breathe through your mouth, you're actually decreasing the pH in your mouth. So that will lead to cavities. It also leads to the bad pathogenic bacteria building up, leading to gum disease. It changes the oral microbiome to become pathogenic. And it decreases nitric oxide production because when we breathe through our nose, we're increasing nitric oxide production. Nitric oxide is so important because it dilates our blood vessels, which helps keep our heart healthy and our blood pressure low. But when we're breathing through our mouth, we're not getting that. And what we know is our nose has all these cilia and turbinates in them. And the whole function of the nose is to filter the air. So anything that you breathe into the body is clean by the time it gets into your system. Well, if you're bypassing your nose and you're breathing through your mouth, you're just breathing in all of those pollutants into your body, which also causes systemic inflammation. And that will exacerbate allergies, congestion. So a lot of times people tell me, hey, doc, I can't breathe through my nose because I'm so congested. And I'll challenge them and say, put some mouth tape on during the day. And you got to retrain your nose to filter. And once it
Whoa.
starts filtering, it'll feel like you're breathing through a straw for a while. But unless you have a polyp or a deviated septum or something like that, you will be able to clear out your congestion and open up your nasal passages again.
And is there a special kind of tape you have to use for that?
No. So, I buy mine off of Amazon. It's a little X that I like, but no, you can use masking. You can use whatever you want.
Okay. And you
But
don't
what's
like
nice,
rip your skin off after.
no,
Okay.
if you do stop breathing in the middle of the night for whatever reason, you will subconsciously rip it off. So it's not like no one's going to die from having mouth tape on.
Okay.
It's not that strong.
Okay.
Your jaw's way stronger, and it'll find a way to breathe if it needs to. But I
Amazing.
would definitely, if someone's, a snorer or a mouth breather, I would definitely encourage them to get tested for sleep apnea before just going to mouth tape.
Yeah. Okay. So let's relate this all to fertility or infertility.
Mhm.
So let's talk about the oral fertility connection. And then I
Mhm.
would love to hear your own fertility journey because I know you were a fertility patient for many years.
Yeah. So the oral fertility connection is super strong, and we've known it for forever because a lot of patients are told don't go to the dentist when you're pregnant. And so we know that it's existed. We just didn't really know what it was. And there's been so much research out there showing that the mouth contributes to a patient's ability to get pregnant. It contributes to their ability to maintain the pregnancy. And it contributes to the ability for the mom to deliver a full-term baby. And it also contributes to her developing preeclampsia, gestational diabetes, and health afterwards.
Mm.
So it's kind of all along the trajectory that the mouth is implicated in this. And there's specific bacteria, PGFN, AATF, for example. Those are abbreviations, obviously, that we know get into the bloodstream. They love to go to the female reproductive system and the male reproductive system. It affects males also, and it will wreak havoc there. So from anything from preventing ovulation to preventing embryo implantation to changing the sperm shape, motility, and
Wow.
morphology to causing preterm labor, gestational diabetes, preeclampsia, all those things.
So I imagine it's not the kind of thing where you'd go to a fertility doctor and they'd be like, let me check the bacteria in your ovaries, right? So is that something that's diagnosable, or is it the kind of thing where if you're having a problem, make sure you're having your oral health taken care of so that it doesn't exacerbate the problem?
That's a really great question. So how I got into the bacteria testing was because of my journey being a fertility patient. They, reproductive endocrinologists only, most of the time, 90%, 95% of the time, only look at the reproductive system. It's like they have this tunnel vision that's like, let me see your uterus and your ovaries and your fallopian tubes and your vagina. That's like all I care about. They don't look at anything else. And what we know is there's a vaginal microbiome, which I'm not an expert in, but that really contributes to someone's ability to get pregnant. And then we know that the mouth directly affects their ability to get pregnant and to have a healthy pregnancy. They do not test for this bacteria, which is why dentists have this very unique opportunity to really help patients, because it's a very simple saliva test. You spit in a tube, you get the results in about 7 days, and then you can find out if the bacteria are present, if they're affecting your fertility, and then how to best treat them, because it's not a blanket treatment. It's very specific to the bacteria that are present. And I want to make sure that people know it's not just the woman, because, being a fertility patient, there's so much, I guess, ownership or blame that's always put on the female.
Yes.
But in fact, 50% of all infertility issues are caused by the man. And we know that this oral bacteria is directly affecting their fertility as well. So not only does the woman need to get tested, but so does their partner. Even in same-sex couples, because we know when we're intimate, we're swapping spit. And when you swap spit, you're swapping bacteria. So if we treat the carrier, but we're not treating the partner, the carrier is just going to get reinfected by the partner.
So if you were to find this bacteria present, what are some of the treatment options?
So the baseline treatment option is to do what's called a scaling and root planing, which is a cleaning that goes underneath the gum line. So what I had mentioned earlier about the gram-negative anaerobes, the bacteria that can't live on oxygen. So they if they're exposed to oxygen, they'll die. So what they do is they burrow underneath the gum tissue, into the gums, and onto the root surfaces of the teeth. So you have to do a regular prophylactic cleaning that you get every 6 months is not going to get that. So you got to do scaling, root planing under the gums. But then there's 6 out of the 11 bacteria that I test for are resistant to that type of cleaning. So then you have to go in and do other things to try and get rid of them. So some of the bacteria are, they love to live in the tissue. They're very tissue invasive. So for that, I like to use, tissue lasers to go in and kill those bacteria. If I have some that are resistant to the cleaning alone, I may use some ozone therapy or some antimicrobial irrigation to try and get rid of those bacteria. So it totally depends on the bacterial profile. And if the infection is pretty severe, systemic antibiotics are needed, unfortunately.
How many dentists know about this?
I need to
Besides
get that
you, I know
statistic.
you're one, but I
Yeah.
feel like there are no others. Are there?
There are. There's a few communities of us out there that will do this type of thing. You got to look more for like the biologic dentist will do something. Yeah. And my book. Thank you. the biologic dentist, if someone's looking for more testing like this, a good thing to search for is like a biologic dentist. But that's not even guaranteed that they will do it. I've heard of a lot of biologic dentists that don't, which is interesting to me. So, make sure you call and ask if they're doing saliva testing, or, of course I can do it for patients as well.
Sure. Crazy. Okay. So how did you figure this out during your own fertility journey?
Yeah. So I was a fertility patient for 6 years. And it's such a horrible, horrible process. I was 33 when I started trying to get pregnant. High stress job. I was working, crazy amounts of hours and probably not the healthiest then. And you go to your doctor and you're like, what happened was I got pregnant naturally 4 months after trying, but I miscarried.
Sorry.
Um, and then I got pregnant again and miscarried again. And so then I was like, okay, I'm just impatient. Let's go get some tests and figure out what's going on. Well, all they tell you at that point is like, you got to wait a year before, we'll actually treat you. And it's like, I don't want to wait a year. I need
Yeah.
to get in now. Like, there's a reason why I'm trying now. And in a year, I'm going to be even older. The eggs are going to
Right.
be even less and of worse quality. So, like, why are we not trying to do this now? That always baffles my mind. Um, and then when I got tested for everything, my diagnosis was unexplained infertility. And I'm like, how can this be unexplained? I don't understand how you can't figure this out. Right.
Mhm.
But they don't offer you any alternatives to try and improve your chances of getting pregnant. It's just, well, let's move into IVF and IUI, and see if we can get you pregnant that way. And I was naive enough to not really go out and search for our alternative methods, which is why I'm so vocal now about trying to get on podcasts and trying to tell people that there are other means out there, because being at the time a strictly Western type style of dentist, I believed the Western type style of reproductive
Mhm.
endocrinologist, and so I just did what they told me to do, and their treatments were not effective, and we couldn't really figure out why. And so I started really digging in and doing my own research to figure out what else could be out there that I'm missing. And so I looked into acupuncture, reiki, nutrition, that kind of thing. But being in the dental field, I happened to just get exposed to this oral microbiome testing, and I started looking at it and I was like, oh, I've heard of these bacteria. These are the ones that are affecting fertility. And on the test, it actually says this affects fertility. And so I said, okay. And I happened to have a couple come into my practice, at a brand new office that I opened at the time. And they were referred to me by their OBGYN, not specifically. She just said, you need to go see a dentist. And so she had found me. I wasn't even advertising that I did this. And they walked in and she said, we've been trying to get pregnant. We can't get pregnant. My doctor said to come see a dentist. And they were in their young 20s, super healthy. And I looked in her mouth and it was apparent just from looking that she had massive oral infection. And so did her partner. And so I said, hey, I'm doing this new test. Let's see what it comes back with. And sure enough, she had all the bacteria, and he did too, that were through the roof. And so we rendered the appropriate treatment. We retested it them, which is really important. People miss the retest because sometimes you can't get the infection completely under control with just one round of treatment. Sometimes if the infection's been there a while, you need to hit it a couple times. And so we did a couple of treatments on her, and they were pregnant 3 to 4 months later.
Wow.
Now, obviously, I can't say cause and effect. It could
Sure.
just be chance. But what I do know is that we made her healthier, so that I can absolutely guarantee that she had a much healthier pregnancy and healthier outcomes because her oral health was better.
Mm, mm.
So then
Okay.
I was like
So
convinced
yeah. Okay. So
everybody
yes,
needs this.
let's go back to you. So the treatments weren't working. You found these bacteria. How were you able to treat it for yourself?
So I actually didn't have the bacteria myself. Um, being a dentist and knowing all this, I was like, oh, I should probably get, checked before I go down this route. So I made sure to do all my own testing. What I did have though was I had an old root canal tooth, and I took a 3D scan, and I found in the scan that the root canal had abscessed and I didn't know it, which is
Mm,
very common. That's why a lot of biologic dentists hate root canals. So I was able to get that tooth removed before going into my IVF treatment, and ended up getting a dental implant later when I was all done with everything. So in terms of the bacteria on me, I didn't have it, but it's just something that as a dentist I can provide to other patients. Because when you're a fertility patient, I mean, they poke and prod you and you're injecting all this stuff all the time. And it's very invasive, painful, expensive treatments. And there's so many other things that you could do that could really help your chances naturally that are inexpensive and not painful to have done. And so as an oral healthcare provider, I feel like this is something that I can offer to people that will really help their journey, help improve outcomes. And it's not like telling someone, oh, you have something that's not fixable, right? It's
Yeah.
you have this infection, but we can clean it up.
Right. And we don't know for sure that'll be the thing, but it could be one of the
Yeah,
things.
totally. It's all contributing factors.
Okay. So how many rounds of IVF did you end up going through?
6.
Oh, and where did we end up?
So I did 6 rounds of IVF and I had 4 miscarriages. And towards the end, I kept miscarrying euploid embryos. So we would do
Sorry.
chromosome testing and we knew that they were good. I would get past the heartbeat and I would get to like the 12-week final check before you go to OBGYN and the heartbeat would stop.
Ugh,
And we had no idea why. My hormone levels were always fine, uterus is fine. And so I had 1 shot left, 1 embryo left, and I ended up going with a surrogate. And so I have a son. He turns 1 in next week.
happy
Yeah.
birthday.
So
Amazing.
we were actually never able to figure out what was going on with me.
Yeah.
But I have a son, so I'm okay with that.
Yeah. It's so brutal.
Brutal.
Yeah. How was your surrogacy experience?
She was someone that I knew. She happened to reach out to me just, I was like not interested in doing another transfer or having a surrogate. I had just shut down. And it was during COVID and I had got a random text from her and she said, hey, I'm thinking about becoming a surrogate. And I remember, because we hadn't spoken in a long time, that you were having difficulty getting pregnant. I don't know if you've ever been able to have a child, but would you ever consider me being your surrogate?
Oh my
So it
God.
was a much more personal experience than most people have. Most go through an agency.
Mm-hmm.
But she took wonderful care of him. And she took better care of him than I probably could have, honestly, carrying him.
Was
So
she
yeah.
local to you?
No, she was across the country.
Did you fly in for appointments and stuff or no, because it was COVID?
It was COVID, so we didn't. She came out here 4 weeks before she was due. So we got to have like the last 4 weeks together, and then she came out for the baby shower as well. But other than that, like we would just FaceTime for
Yeah.
appointments. And I think that was good for me, honestly, because there's so much you can't control with a surrogacy
Yes.
experience. And so having that physical distance, I feel like was probably good and probably kept me more sane than if I was close by worrying about everything.
I understand that perspective.
Yeah.
Okay. So dental speaking, like what are the top 3 or 2, or like what is the most important piece of dental advice you want to give?
So I tell people all the time, you have to get a saliva test. You don't know. I literally, right before I got on this podcast, I had a call with a patient who, has been going to the dentist regularly. She's a fertility patient, unexplained infertility, all this stuff. And she just had a cleaning on Monday. So a couple days ago. However, I just got her test results back and she said her dentist said everything was totally fine with her gums. I get her test results back. They're the worst I've ever seen in any patient.
Well,
She had a genetic.
how do you even ask for a saliva? Like, what do you ask for and how do you get it?
So what I recommend for patients to do is to call, start with biologic dentists, ask them if they do my testing.
Sorry,
I would
say
also
that
ask
again because you had cut out for 1 second. Ask them if they
Sure.
do.
Saliva testing or microbiome testing.
Okay.
That's a good way to start. And you don't know what's present if you don't test. Like this one patient's been going to this dentist forever and he or she, I'm not sure, is telling her that everything's fine as of Monday. And yet I have a report saying, no, you have a massive infection that's in your body that's affecting, I mean, it was affecting her heart, her brain, her metabolic system, and her reproductive system. And so we got to get that cleaned up, but you don't know unless you have a test result. It's just like, you don't know if you have diabetes unless you test your blood sugar. So I tell everyone you must get a saliva test. If you can't find a dentist that will do it for you, people can go to my website and book a test through my website.
Oh, that's good.
That's what most people are doing now, because most people already have dentists, but they don't provide the service. And so I'll do the test for them and then do a care plan and work with their current provider on getting them the appropriate treatment.
And you can do that in any state. Like you're not governed by state licensure. Like you can't, anybody in any state can order that test and you can do the work on it.
Yes, I can't diagnose or treat unless I'm
Okay.
licensed in that state. All I can do is coach
Okay.
legally. Yeah.
Okay.
And then another thing that people should absolutely do is get a cone beam CT scan, a CBCT scan. It's a 3D scan. Our teeth and jaws are three-dimensional objects, yet traditionally we've only ever looked at everything two-dimensional.
Mm.
And that's how I found that abscess on one of my roots of my root canal. I would have had no idea otherwise. The x-rays, the traditional x-rays that I had taken showed nothing. I wasn't having any symptoms, so I didn't think that anything was wrong. And it wasn't until I took this 3D scan that I was like, oh my gosh, something is not right. The 3D scan will check for all of that. And it also checks your airway volume to see if you might be at high risk for airway disease. So I would tell everyone to do that as well. And then the last thing that I always say is getting your teeth cleaned twice a year is not enough. That cadence was established by insurance companies. It's not based on science. It's not based on health. And given that over half of the population have gum disease and they've been going and seeing a dentist twice a year, I would venture to say that that's not good enough. We should be preventing disease. And the way that we prevent it is by going in and seeing your dentist more often. I always tell people they should go in for cleanings every 3 to 4 months. We know that the bacteria repopulate the mouth every 90 days. So doubling that time and waiting 6 months, 3 more months after that, I mean, you're setting yourself up for possible, integration of disease by that point.
Oh my God. I'm like, I immediately need to book with my dentist.
Well, just catch it early. That's the thing. When you catch it, sure, insurance isn't going to pay for all these cleanings.
Right.
I'll say that, but it's paying an extra $60 for an extra cleaning is way cheaper than paying for a deep cleaning and then paying for periodontal maintenance therapy every 3 months if you do get diagnosed with gum disease.
Right.
So,
Or paying to go to a cardiologist because you have heart disease now.
totally.
And then in terms of non-dental life, is there like a phrase or a cliche or any piece of advice you like to think about or give?
Oh, that's really interesting.
Could be as cliche as like today somebody gave me pay it forward, right? Like they live by the, right? It could be that. Or some people are like, oh, my grandma always said, don't buy green bananas, which my grandma did say.
That's really funny.
Yeah. Because she was
No,
always like, you live in the present. You can't buy green bananas in case you're not around to watch them ripen.
yeah. Something that's on my mind today, just because I'm working on my new health center today. And I had someone call me about another dental company that they wanted me to look at. And I said, the best return I've ever gotten is investment in myself. Instead of investing in other people or other people's
Love that.
businesses, invest
Yeah.
in yourself.
That's a really good one. It's
That's
a really good one. And no
on
one's
my
given
mind.
anything like that ever. So I love it.
Oh, cool.
Yes.
First
Well,
dentist and first investment advice.
that's right. And we're gonna link out in the show notes to, I believe, the first chapter of your book or
Great,
some
yes.
piece, yes, which I'm very excited about. I have it here.
Yeah, they can get it for free.
It's
Yeah.
amazing. Thank you for doing this. Congratulations on your son's first birthday. That's a huge
Thank you.
milestone. And I
Thank
just
you.
want you to like talk at every dental convention so everybody can get on board with this.
I'm trying. You met my PR person.
Yeah,
She's really
she's
good.
great.
So, yeah. So
She's great.
hopefully I'll be doing that.
Okay, good. Thanks for being here.
Thanks for having me.